Welcome to Ulosca channel. Access all nursing practice questions. RN Community Health Practice questions with answers.
Question 1. What is the primary focus of community-oriented nursing? A. Direct care to individual clients. B. Acute care interventions. C. Disease management in hospital settings. D. Health promotion and disease prevention for populations. Which one is the correct answer? The correct answer is D. Health promotion and disease prevention for populations. Explanation. Community-oriented nursing focuses on improving the health of entire populations by addressing the root causes of illness and promoting wellness and disease prevention, rather than focusing solely on individual patient care. Question 2. A nurse is teaching about primary prevention. Which is an example? A. Mammogram screening. B. Administering antibiotics. C. Health education on smoking cessation. D. Physical therapy after injury. Which one is the correct answer? The correct answer is C. Health education on smoking cessation. Explanation. Primary prevention aims to stop diseases before they start. Health education on smoking cessation is a preventive strategy that reduces the risk of developing chronic illnesses like cancer and heart disease. Question 3. Which activity represents tertiary prevention? A. Blood pressure screening. B. Teaching insulin administration to a diabetic patient. C. Hand-washing education in schools. D. Promoting helmet use. Which one is the correct answer? The correct answer is B. Teaching insulin administration to a diabetic patient. Explanation. Tertiary prevention involves managing long-term health conditions to prevent complications. Teaching insulin use to a diabetic patient is a way to help control blood sugar and prevent worsening of the disease. Question 4. What is the first step in community assessment? A. Collecting data. B. Planning interventions. C. Identifying funding sources. D. Implementing programs. Which one is the correct answer? The correct answer is A. Collecting data. Explanation. Community assessment begins with data collection. Nurses gather information through surveys, interviews, and observations to understand the community's needs and strengths before planning any intervention. Question 5. Which client scenario reflects the use of case management? A. Coordinating services for a homeless client with mental illness. B. Conducting a vaccine clinic. C. Discharging a surgical patient. D. Teaching healthy eating to a school group. Which one is the correct answer? The correct answer is A. Coordinating services for a homeless client with mental illness. Explanation. Case management involves coordinating care across multiple services and systems, especially for vulnerable populations such as homeless individuals with mental health needs. It ensures continuity and access to needed services. Question 6. A nurse is conducting a windshield survey. What is the purpose? A. To monitor environmental pollution. B. To gather first-hand observations about the community. C. To determine infection control protocols. D. To identify disease outbreaks. Which one is the correct answer? The correct answer is B. To gather first-hand observations about the community. Explanation. A windshield survey involves driving through a community to directly observe housing, businesses, schools, transportation, and general living conditions. It provides a visual overview of the community environment. Question 7. What is the goal of epidemiology in community health? A. To treat illnesses at the bedside. B. To reduce hospital-acquired infections. C. To study distribution and determinants of health conditions. D. To write medication protocols. Which one is the correct answer? The correct answer is C. To study distribution and determinants of health conditions. Explanation. Epidemiology is the study of how diseases spread and what factors influence their distribution. This helps public health professionals develop strategies for disease prevention and health promotion. Question 8. A nurse visits a home where a toddler is exposed to peeling paint. What is the priority action? A. Educate about healthy snacks. B. Recommend toys for stimulation. C. Notify local health authorities. D. Refer for family counseling. Which one is the correct answer? The correct answer is C. Notify local health authorities. Explanation. Peeling paint may indicate lead exposure, especially in older homes. Lead poisoning can cause developmental delays and cognitive problems in children. It's a reportable environmental health hazard requiring prompt action. Question 9. A nurse is planning a community education session on disaster preparedness. Which population should be prioritized? A. Young adults. B. College students. C. Elderly adults living alone. D. Middle-aged homeowners. Which one is the correct answer? The correct answer is C. Elderly adults living alone. Explanation. Elderly adults, particularly those who live alone, are more vulnerable during disasters due to potential mobility issues, lack of support, and chronic health conditions. Prioritizing their education can help reduce their risk. Question 10. In disaster management, what is the nurse's role during the mitigation phase? A. Triage victims. B. Assess shelters. C. Educate the public to reduce risks. D. Deliver emergency aid. Which one is the correct answer? The correct answer is C. Educate the public to reduce risks. Explanation. Mitigation occurs before a disaster strikes. The nurse's role is to educate the community to reduce risks, such as teaching about fire safety, emergency kits, and evacuation plans to minimize harm during disasters.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.